Hey guys, what's up? It's Tink here, and I was coming to you guys today because I know I said I wasn't going to do this video until next week, but I feel so much better and I had time, so I figured, what the hell, let me do it. So I wanted to come to you guys today to talk about TMJ, because a few more of my subscribers asked me to explain it, a little bit more. Now, I've already done one video, but I know I've done, I got a good amount of videos up by now. You may not want to scroll back through them, so I don't mind. But I'm also going to address a few issues that a few of my subscribers are having as well, but I'll save that for the end of the video. So as always, I start out by thanking my subscribers, because if it was not for you guys, I would not be here today. Please excuse the snowiness of my videos, because I know my videos are usually clear. My phone is acting up right now, so I'm on my tablet. So hopefully I do this right, and hopefully I know how to upload it through my tablet, because I've never done it through my tablet. But I may get more time. I know I'll get more time through my tablet than my phone is giving me right now. I don't feel like I'm fussing and fighting with my phone. So we're going to use the tablet for today. So I'll address the other issues after I finish, explaining what TMJ is. Happy New Year, you guys. I hope you all had a wonderful, happy, Merry Christmas and a wonderful, happy, and blessed New Year. A special shout out to Crystal Terry and Michael Huey. Happy New Year, because you sent me a direct Happy New Year comment, so I wanted to shout you guys out. Cindy, I got all your comments, and I'm going to address your issues. And I'm going to wait to the end of the video, because I want to get the TMJ stuff out the way first. But yes, I have a few tips for you. I need to show you some things I use, ways that you can help the situation that you're having. So that I will explain after I explain what TMJ is. And Crystal, though, before I start that, I want to say congratulations. I am proud of you. 2 thumbs up. Good luck. Don't be scared. You got this. Just think of everything that you're going to be gaining by doing what you're about to do. What you're about to endure in is going to be a challenging journey, but it's going to be well worth it. I promise you. If you need anything, someone to talk to, tips, you want to know what you need to do, things you need to buy, the process, what to do, please, 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 don't hesitate to just shout out. Send me a shout out, comment below. I'm going to include my email address in the description box. So if you feel more comfortable doing that, you don't want to do it through the comments, you can shoot me an email. We can converse back and forth. I don't mind. I don't have a problem with it. But I do want to tell you, I am proud of you. I am so proud of you for you taking this step, and I am here rooting for you. Woohoo! Okay, you guys. Now, getting into what TMJ is. Number one, I want to explain to you what the acronym means. So TMJ is an acronym that stands for temporal mandibular joint. Okay? These are joints that are located on both sides of your face, and they are literally just in front of your ears. And if you go like this, you can actually feel where those joints are at. Okay? TMJ, or temporal mandibular joints, they actually connect your lower jawbone to your skull, and they assist in movements like chewing and speaking. So we need those. Okay? TMD stands for the actual disorder, the temporal mandibular joint disorder. Okay? And this refers to any dysfunction of your TMJs. TMJ dysfunction occurs when the muscles and ligaments around your jaw joints become inflamed or irritated. This condition can be acute, it can be chronic, it can have mild or severe pain. Now, I have experienced both mild and severe pain, but it can be either or. There are a good amount of symptoms and causes of TMJ, okay? TMJ can be caused by injury to the jaw joints or surrounding tissue. Other issues that bring on TMJ are bruxism, or what is called, or well, what is believed to be clenching and grinding of the teeth. That's called bruxism or bruxism. That can cause TMJ. Dislocation of the disc between the ball and the socket joint, that can cause it. Arthritis in the TMJ. So if you get arthritis in this joint, that can cause it. Stress can cause it. Acute trauma can cause it, and an improper bite can cause it. Now, acute trauma is what I had experienced. I sustained injuries to my face years ago when I was younger in an abusive relationship. He kept hitting me in my face, so it knocked my jaw to the side a little bit. I chose, again, not to have my jaw broken when it was time for me to get my procedure done because, number one, it would have kicked me back about 2 months of healing. And then wearing my dentures, and I didn't want that because I wasn't sure if we had to go back to work, because I did all of this during the pandemic, so I wasn't sure if I had to go back to the office. I didn't want to go back to the office with no teeth, so I opted not to have my jaw broken, which they actually, asked me did I want to do and said it may be better for me, but I didn't want to go through that at that time, so I did not have my jaw broken. Therefore, some of mine come from the trauma that I sustained years ago. But an improper bite can cause it as well. TMJ dysfunction is the most common in those 20 to 40 years old and is more common in women than in men. Some of the most common TMJ symptoms include jaw pain, headaches, earaches, pain in the neck or shoulders, difficulties opening your mouth wide. Your jaw can lock in the open or closed position, meaning locked jaw. And I've experienced locked jaw at least once or twice so far, where you can go to yawn and that joint, something hits that joint or irritates it and your mouth is stuck open. Or you can go to close it and something irritates it in there, you can't open your mouth. It's called locked jaw. Clicking, popping, or grating sounds in the jaw joint when opening and closing your mouth. If you hear that, that's a form of, a symptom from TMJ. Get it checked out. A tired feeling in your face. Difficulties chewing. Ringing in the ears, or how do they say it? Tinnitus. And ringing in your ears. Changes in the way your teeth fit together, meaning the bite, the way you close it. Excuse me, give me a second. Come on. You don't want to get up here? Come on. Come on. Oh my God, he's such a mama's boy. I'm sorry, my dog always wants to be up in my face. Anyway, getting back to it, the ringing of the ears, changes in the way your teeth fit together, swelling on the sides of your face, and tooth pain if you do have natural teeth. All of these things are symptoms that can cause TMJ or symptoms of TMJ. I've had the jaw pain before. I've had the headaches. I don't get headaches, but I get a lot of head pains and sensitivity to my scalp. I had what I thought was an earache, but it was actually the tinnitus from, the ringing in the ears and the TMJ. I've had difficulties chewing. I've had locked jaw. I've had pain in my neck and my shoulders. When your bite is off and when you're wearing dentures, if your bite is not correct, if your bite is off, that will cause you TMJ symptoms. So you have to make sure that your bite is correct. When I say your bite is correct, I mean no space. Your teeth touch each other. They're even. When you chew and you bite, you can evenly chew. Make sure your bite is correct on your dentures, or that will cause TMJ as well. And making sure everything just fits, period. Making sure that your jaw is aligned can help with the symptoms of TMJ. TMJ is diagnosed through different forms of tests, okay? In most cases, TMJ dysfunction is diagnosed during a dental checkup. Your healthcare provider will observe the range of motion when you open and close your mouth. They may press on your face and jaw to determine where the areas of your discomfort is at. And they may feel around your jaw joints as you open and close your mouth. Like I was telling you when I said you can feel it yourself. In addition to that, they can do panoramic X-rays, which show a broad overview of your teeth, jawbone, and your joints. They can also do a CBCT scan, which is basically a computed tomography scan, which captures thousands of images of your teeth, jaws, facial bones, and your sinuses. These pictures are then stitched together for a detailed 3D image. Dental CT scans give your healthcare provider a more detailed view of your facial anatomy. And then they can also do MRI scans. In some cases, MRIs may be used to view soft tissues in and around the jaw. Or you hear somebody. Calm down, it ain't nobody but Valencia. And with the MRI is used to view soft tissues in and around the jaw joint. The images show the position of the disc, inflammation, and possible jaw locking. This can tell your healthcare provider if the TMJ disc is functioning properly and in good condition. Most of the times your dentist will refer you to an oral surgeon, because oral surgeons are, if I'm not mistaken, the only people that can actually help you with TMJ. Your normal dentist may not be able to. But there are ways for you to manage and treat TMJ at home if it's not too severe. Okay? So some of the treatments range from simple self-care practices and conservative treatments to injections and open surgery. Most experts agree that treatment should begin with conservative non-surgical therapies, with surgery left as the last resort, because some surgeries are risky. Your healthcare provider will most likely explore the variety of the treatments that you can do. But I will explain what some of these treatments are. So, some examples of the non-surgical TMJ treatments are applying moist heat or cold packs, which can help with pain and everything. You can do that on the side of your face in your temple area for about 10 minutes for acute pain. You can do a few simple stretching exercises for your jaws. Your healthcare provider or dentist can show you that. Eat soft foods when it is causing you pain. Eat soft foods. Take over-the-counter medications like Tylenol, ibuprofen, Advil, Aleve, to control the pain. Sometimes a low dose of antidepressants can be given to actually reduce and control the pain too. Sometimes muscle relaxers are given, anti-anxiety drugs. You get what I'm saying? They can sometimes be used for pain too. But I would say go with over-the-counter first. You can wear a splint or a night guard if you are one of those people that do grind your teeth. It's easy, whether you have natural teeth or dentures, because I know people that do have dentures that actually still grind their teeth with their dentures in. So just get a night guard, that'll, or a mouth guard, that'll help with the grinding and stuff, or the bruxism. You can undergo corrective dental treatments, and this is for people that may have natural teeth. And these treatments can include replacing missing teeth or using crowns, bridges, or braces to bring your teeth into proper balance and alignment. For people with dentures, make sure that your bite is good and it's straight and it's not off. Make sure that your teeth on your dentures are not worn down. Make sure that everything is lined up, period. And that will help with the symptoms as well. Avoid extreme jaw movements. Keep yawning and chewing to a minimum. Don't rest your chin on your hand or hold the telephone between your shoulder and your ear. Practice good posture to reduce neck and facial pain. I'm working on that one because I slouch a lot. Keep your teeth slightly apart as often as you can to relieve pressure on your jaw. Because sometimes, especially when we wear the dentures, you're getting used to them. So I used to have a habit of biting down. I still do it sometimes off and on, but when I first started wearing them, I used to bite down on the dentures all the time. And I don't know if it was because I didn't have teeth and now I have teeth, so it's like, oh my God, I have teeth in my mouth. I don't know if it was because of that or not, but I did used to bite down a lot, and that caused a lot of jaw pain too. So try not to do a lot of that. To control the like I said, the clenching or the grinding during the day, place your tongue on the palate behind your upper front teeth, and that may help. Learn relaxation techniques to help control muscle tension in the jaw. Some other TMJ treatments are ultrasound, which is a deep heat treatment that is applied to the TMJ to relieve the soreness or improve joint movement. Trigger point injections, which is pain medication or an anesthetic is injected into tender muscles of the face called trigger points to relieve pain. Something like Botox, basically. It helps reduce the muscle mass and inflammation. And then radio wave therapy, which it means radio waves create a low-level electrical stimulation to the joint, which increases blood flow and provides TMJ relief. Now, I never heard about that one, so I don't know. I don't know about no radio wave therapy, but either way, these are some of the treatments. And then you have some other strenuous treatments which turn into surgeries, like Arthroscentesis, which is a minor procedure that is performed in the office, usually under local anesthesia. It's often recommended when the jaw suddenly locks in the closed position. It can also help reduce inflammation in the TMJ. Needles filled with sterile fluids are inserted into the affected joint, and the joint is then washed out or rinsed. Occasionally, a surgical instrument is needed to remove scar tissue or to dislodge a disc that has moved out of place. Then you have arthroscopy. This procedure is performed under general anesthesia. Your surgeon makes a small incision in front of the ear and inserts a small thin instrument that contains a lens and a light. This instrument is hooked up to a video screen, which allows the surgeon to examine your whole entire joint area. They may remove the inflamed tissue or realign the disc or another area of the TMJ. Because this surgery is performed through tiny incisions, there is less scarring and a shorter recovery time. It's less discomfort and fewer complications compared to open joint surgery, which is one of the last ones, and this is one of the more risky ones. So you have open joint surgery. If you undergo open joint surgery, you'll be given general anesthesia, unlike with the arthroscopy. Open surgery is a traditional procedure in which a long incision is made to insert instruments. Open joint surgeries may be necessary if the bony structures that make up the jaw joint are wearing away, there are tumors in or around the TMJ, or there is severe scarring or bone chips in the joint. Okay? But open joint surgery results, it results in a longer healing time, plus has a greater chance of tissue scarring and nerve injury. So you really don't want to have to get to that point. So I would say if you are struggling or dealing with TMJ symptoms or having those issues, be mindful too that TMJ also causes symptoms of vertigo, feeling dizzy, off balance, nausea, all of that. Because I also experienced that too. But if you are suffering or having symptoms of TMJ, please contact your dentist and ask them what to do, because they'll probably refer you to a oral surgeon like they did me. But there are also other alternative treatments that you can do at home that can help. Relaxation techniques, mindfulness or meditation, acupuncture, pain management referrals, things like that. You can be sent to a pain psychologist or pain management clinic to help with those symptoms as well. You can reduce the risk of TMJ, like I said, by practicing good posture, wearing a night guard if you clench or grind your teeth, wearing a mouth guard when playing contact sports, practicing relaxation and stress reduction techniques, okay? If you experience TMD symptoms commonly, like on a normal basis, and of course, like I said, such as the jaw pain and difficulty opening your mouth and all of that, you should schedule an appointment to see your dentist, because the dentist can help by referring you to a surgeon who can then actually help you either figure out ways to deal with TMJ or give you things and techniques to do that with, okay? So please just be mindful of that. If you are having all of that pain, like I have the head pain here and here, and I get different head pains all over, I get the scalp sensitivity, I get the pain in my neck and my shoulders, in your back. Like, you get these pains because everything is kind of interconnected, and when everything is connected, then certain pains will then go down and hurt or go up and hurt. So you have to be mindful of that. Everything is interconnected. Your jaw is connected to your skull, which is connected to your spine, which is connected to your back and your shoulders. All of this is interconnected, so everything is going to hurt. Just be mindful of that. Don't sit in pain. Contact your dentist, and they will refer you to someone who can help you. All right, you guys? I just want everybody to be good. Moving on to Cindy. Cindy. I honestly think that I may know what's going on with you. You said that you got your dentures in October, but due to bone spurs, you wasn't wearing them, and then you got sick and you couldn't wear them. Number one, that is one of your issues right there. You've only been in your dentures for a full month, so technically your mouth is not really used to wearing the foreign object. Your body is not used to having that foreign object in your mouth. You know, your body could be rejecting the fact that you're wearing them. One of the most important things you have to remember is because you are only in the temporary process or part of this, you have to make sure that you are wearing your dentures. Number one, your dentures help to promote healing. They help to protect and promote healing with your gums. They help protect your gums. The temporaries were given to you to promote healing, to help you with healing, to protect your gums, and to give you a smile and allow you to eat while you are still healing. If you are not wearing your dentures daily like you're supposed to, you're never going to get used to them, so you're always going to have issues out of them. So you have to make sure that you're wearing them every day. If it gets to the point where you absolutely cannot wear them, then it's time for you to contact the dentist, because I think most likely that if your dentures are loose and ill-fitting and you have space in between them, and no matter what you're putting in, whether it's the powder separately from the cream denture or both together, and they're still not sticking, then your dentures may be loose. You may need an adjustment and a reline. If you cannot make it to the dentist to get an adjustment and a reline done, there are a few things that you can actually go online and purchase and do a reline at home. Just make sure that you contact your dentist and ask, is it okay? I can show you a few of the things that I have and explain to you what they do. Some of them that I have used thus far when I was in my temporary stage to help me, first and foremost was cushion grip, which is a thermoplastic, like a silicone lining. You can get them either in the small tube or the big tube. It's cushion grip. It's a thermoplastic lining that you can actually use. It comes in a box that looks like this. I get it from Amazon. It's very inexpensive. You can $6 for this one, $10 for this one. But you use the key, the little silver key that comes with them. Use this to put in on the tube. You put the tube in hot water for about 5 minutes, because you have to let it get soft and pliable. You would open the tube up, pull, a little bit out, no more than, pea size, or, a little bit bigger, just where you can either cover your whole entire plate with it, or you can just put it in the areas that you think you need it in. Either way, cushion grip is a thermoplastic lining that you can use to fill in gaps and spaces, that you have in your dentures. That can create comfort as well. That's one of them. It's another one that I use is called comfort lining. The tube looks like this, similar to the cushion grip. The difference is that you put this down in boiling water, and you have to boil this in water for 10 minutes. It makes it pliable. You take it and you pour it in your and I'll show you with my first permanent. 10 minutes of boiling water, you take it out, take the top off. It's a clear color. You put it all in your denture. Put your denture in your mouth. You hold it in your mouth for about a good, 3 to 5 minutes. It will conform not only to your denture but to your gums to fill in the pockets and give you comfort. This feels like a pillow of just soft silicone, but it's yet another thermoplastic denture. They say it's an adhesive, but it's actually not an adhesive. It's like a lining. If you have your whole entire plate and you have pretty good suction, then all you should need is the reline, and your suction should come back and you should be fine. I've also tried what is called Densurefit. This is a little expensive. However, to me, it's similar to comfort lining. The comfort lining, I will not lie, this was about $19.99. And you can get that from comfortlining.com. The cushion grip you can get from Amazon. Densurefit you actually can get from densurefit.com, and I've actually seen it in Amazon too. It comes in a box though, guys. You get 2 of these because I've already used it. I didn't really like it because for me personally, I used it with the powder. It did not stick too well to my gums in my mouth. And I used it with adhesive. It didn't stick too well. But I may try it again. I don't know. But either way, this one is a little bit more expensive. I got one application for the top and bottom. So I got 2 boxes with 2 tubes in it. But they come with primer. And it's a little bit of clear liquid. You get a Q-tip. What you do is you take this primer. You put it all in here. You make sure that you prime all of your denture. The inside trough get everywhere. And then you take this. You have to open it up till it clicks. There's a trigger on it. You fill in, just like you would with everything else. You would fill in your trough area first, and then get all over. Pop it in your mouth. You hold it in there for a couple of minutes. It will conform not only to your denture, but to your gums as well. Take it out, and you're good to go. If you have a suction, that's all you should need. However, if you can get into the dentist, which I would actually suggest that you do that first, especially if you don't know what you're doing. See, I've been doing it for a while, so I know how to do it. But if you can't, you go to see your your dentist, and they will put in a lining for you. These are my temporaries that I wore when I first got my procedure done. But I got my procedure done October of 2020, so I've been in my dentures for a year and 3 months now. But as I said before, my upper is horseshoe because I have a really bad gag reflex. Yes, I have to wear denture adhesive every day. That doesn't bother me. I like comfort more than, over not being comfortable. So my upper on both, this is my first permanent, this is my second upper permanent. But if you can see, they were both horseshoe, okay, because of my gag reflex. But this is my temporary. This light pink stuff that you see in here is the reline that the dentist did. It's a light pink material that they put in. To me, I don't like it. It tastes like acetone or something. It's real nasty. But if you go to the dentist and they put this in, it basically remolds to your gums to give you a better snug fit. I'm thinking that you may need that. They do it on the top and the bottom. This is my top. This is my bottom. There's the reline. My dentist did that, and they were fitting me perfect. And yes, you can put your adhesive. You can use powder or cream adhesive with this. It doesn't matter. It's going to still stick. So you may want to contact your dentist, get an appointment to go in. Let him or her know what you are dealing with, what's been going on. Let them know that your dentures are not fitting you correctly. Please make sure that your bite is correct too, because that's another thing that could be bothering you too. Your bite may be off. So just, make sure that you contact them, because if you are not staying up on your adjustments and your relines, you're going to keep having issues as well. But above all, the most important thing is that you have to wear them. You have to kind of force yourself to wear them even when you don't want to. It took me about a good 6 months to fully get used to my temporaries. At least 6 months to fully get used to them. So it takes time to get used to them. I just need you to understand that. It's not going to be an overnight process. I can even show you one more thing if I still have it. Let me see if I still have it, you guys. I may not. This was something that the dentist had me use in my first, month, because I know, in the first month. These may even help you too. I'm not sure. You can try these out. These are C-bond adhesive seals. It may help you until you can get to the dentist. Either way, you need to contact your dentist and let them know what's going on so you can get an appointment to get in there. And then it very well also could be the adhesives that you're using. It may be the brands or the kinds of adhesives that you are using. Me personally, I have tried several different ones. I have my favorites and I have my not so favorites. So I'll show you a few of my favorites that you can actually use too, and they may help you out as well. You never know until you give it a try. Okay, so me personally, today I'm actually wearing I have Fixodent in today, but I normally wear I have a adhesive called Secure. I like this one because this is zinc free, this is waterproof, and it's actually for sensitive, if you have sensitive gums and stuff. So it contains aloe vera and myrrh. So I use this. I get this from Amazon. It's about $5 or $6. That one I love. I'm in love with that one. I usually use that most of the time. But today I actually have in my Fixodent Plus Precision Hold and Seal with Scope. I have a little teeny tube that I had started using. I thought it was cute, but this is what I'm using today. I do love Fixodent because Fixodent, for me, when I put Fixodent and I use it, it's kind of like cement. When I use this one, I sometimes have a hard time getting my dentures out, but not as hard of a time as I have when I use my Fixodent Ultra Max. Now, the Fixodent Ultra Max, it gives you a max hold, like the tube says. But I only really use this one if I know I'm going to be outside of my house for a while, maybe eating out, getting together with friends. Because most of the times when I wear the Fixodent Ultra Max, I just go ahead and accept the fact that I'm going to sleep in my dentures for that night, because usually I can't get them out, and that's using a little bit. That's how good that works. But I only really use that when I know I'm going to be outside my house for a few hours, which I've been in here for the past 2 years, so that hasn't been many times. But I use that one. But I do have this in today. And then I did try the Grip denture adhesive, minty fresh. It says extra strong holding power. It was okay. I felt as though that it held my top in longer than my bottom. To me, it put me in a mind of Fixodent, but it just wasn't that super hold. And then I also have Dr. B's Adhesodent. He has a line of products that is really good. You might want to check that out, Dr. B's. I think the website is Dr. B's Denture or dentalsolutions.com, if I'm not mistaken. Don't quote me. I'll get the right one, and I will add it in the description box when I upload the video. But this was okay too. I just don't think it gave me a hold as long as I wanted. So I use them, but I don't use them a lot. The ones I use the most is my Secure and my Fixodent. This is showing you how much I use the Secure. This is my the tube that I have been using. Thank God I do have a new tube, and it's time for me to order some more, because I usually keep this type of stuff on standby. I usually always have at least 3 of these in my box. You guys, I have 2 different boxes. I have my daily denture box. This is some of the stuff that I use on a daily basis. And then I have my denture box that has all my extras in it. That's why I said I'll be doing giveaways. If you guys want, I do have extra adhesives, strips, and things like that. So if you guys want to, try any new stuff out, let me know. Like I said, I always have extras of something, and I don't mind sharing, but don't go overboard. You can't go overboard. You have to give everybody a chance to actually experience receiving things that, that they want to try. Because I don't get paid for giving this stuff out. I don't have a paid partnership with anybody. I do it out of the kindness of my heart, so please don't go overboard. However, if there's a denture adhesive that I named today that you may want to try, that you have not tried before, you're having falling on bad times, you can't quite get it right now, let me know. I do not have a problem with sharing. This is Avastar. I always have extra Fixodent. I have extra Grip. I also use, now I'm not gonna lie, I started out liking Polygrip because this is like super strong hold all day, but for some reason it stopped working. So I started using the Fixodent powder, extra hold. Now, because I'm in my permanent, sometimes I just use powder. I do 2 layers of this. I have a little small spray bottle, and I'll spray my denture, put in a layer, make sure you get it all around, knock out the excess, spray it again, put another layer, spread it all around, knock out the excess, spray again before you put it in your mouth. And oh my God, this shocked me one day because it kept my dentures in all day. Now, mind you, I wasn't going anywhere. I wasn't leaving the house, but still, I went all day and was able to eat anything I wanted in them. So, it's more so a trial and error. Just try different things until you, can get what works for you. And again, if you want to try some of these things and you are having a hard time getting it, or you don't have them in your stores or don't have it where you live, please, by all means, let me know. Reach out to me. I do not have a problem with sending some of this stuff. I have a habit of buying things to try because of this new situation that I am in. The only way that I'm going to know what I like is by trying different things. So, Cindy, make sure you do that. You know, try, maybe change, the adhesives you're using. But most importantly, please contact your dentist. Let him know or let her know what's going on. And I'm pretty sure that it's probably just a simple adjustment, or reline, whether it's soft or hard, that you may need. And that should help you out a lot. Please keep me posted on everything. Crystal, please keep me posted on everything. I want to know how you guys are doing. My next video will be next week. I'll figure out what we're going to talk about. If you have any suggestions for videos, you can post them in the comments or email me. Like I said, I'm going to add my email address in the description box along with the website for the adhesives. I mean, not the adhesives. I'm sorry, you guys. The linings that I was telling y'all about. The comfort lining and the cushion grip and the denture fit and, the Dr. B's kits and stuff, because Dr. B's has everything from Clinident pads. They help to get these help to get adhesive that's stuck on the roof of your mouth off. They have, I showed you the Adhesivent, which is basically the adhesive. They have what is called Clinident, which is basically like toothbrush or toothpaste for your dentures, but I like Dr. B's because Dr. B's Clinident toothpaste can be used on your dentures and in your mouth itself. They have the electric sonic cleaners. They have this this cleanser that cleans bacteria. Maybe I'll show you guys that too, because I did a video of that too where I showed everything that I had. So maybe the next video I can show y'all some more of the things that I have, because when I tell you I have a lot of stuff in here, I have a lot of stuff in here. I would probably sit on here for an hour or two just showing you guys everything that I have. If you want to see more, if you want suggestions on anything else, just please let me know, guys. I'm always here and I don't mind. Again, next week I'll do another video. I'm going to try to keep doing them every Friday or Saturday and keep up with it once a week, okay? So I hope that I've helped, all of you guys out. If I have not, if I missed anything, please let me know. I will do another video so I can pick up where I left off and include the things that I missed. Again, any suggestions of other videos that you would like for me to do, if you want to see me do things, if you want to see my morning routine when I put them in, my night routine when I take them out, whatever, let me know. If you want to see me eating them to see if you're eating properly, let me know. I don't mind. Suggestions are always welcome, okay, you guys? So again, next video will be next week. Look for that. I appreciate all of you guys, old and new subscribers. I appreciate all the love and support. Please keep supporting me. I will continue to do these videos for you guys. I don't mind. And as always, I'm here for anyone. If you want to talk, if you're having issues, just reach out and let me know. That's what I'm here for. I hope that I am helping you guys, because this is all I'm trying to do, is help those that may be in need of information or anything else. So I'm just giving what I can give. So until next time, you guys already know what I'm getting ready to say. I'm Tink. I love you guys, and I'm out. Peace.